My name is Dr. Bob Bell. I have the privilege of being the President and Chief Executive Officer of the University Health Network, which is, of course, proud to host the McEwen Centre. And this morning, we're delighted to welcome the Premier, Minister Hoskins, Rob and Cheryl McEwen, Dr. Gordon Keller, the Director of the McEwen Centre, Lisa Ray, and Bob Klein.
Ladies and gentlemen, it is such a pleasure to be here this morning to celebrate Made in Ontario innovation, the kind of innovation that is both saving lives and heralding the future of medicine. As a proud Ontarian, I also follow with great interest and great pride the work coming out of the McEwen Centre. That research, those discoveries, continue to reinforce what we know to be true, that Toronto and Ontario are truly world-class centers of innovation. I have been given the rather daunting task of introducing Rob and Cheryl McEwen, two people whose generosity and foresight are at the heart of so many of the discoveries made here at the center that bears their name. Because of their service to the public and the countless lives that will be saved by this crucial research, Rob and Cheryl McEwen are humanitarians of the highest order, and I am proud to call them my friends. Ladies and gentlemen, it is my great honor to introduce Rob and Cheryl McEwen.
We're embarking on a very exciting period with 4,200 stem cell scientists in town. And this area of medicine is the leading area of medicine. It will have profound impact on all of our lives and the lives of our children and their descendants. I'd like to tell you first about how we got involved in it. Back in 2002, I had to go to the hospital because one of my sisters was dying. And she died, and then 4 months later, my mother died. And Cheryl and I spent a lot of time in hospitals during that period, not only caring for our loved ones, but observing the hospital system at close hand and the healthcare system, and coming away with an appreciation that it's under a great deal of stress. And that's how we got involved in regenerative medicine. At first, we looked at it and thought, well, we'll support basic research. And then we looked at it and said, you know, we have some needs now, and we're not getting them. So how do we help accelerate this process so that we can get answers sooner?
As you've heard, Toronto is a hub for stem cell research. That's why this conference in Toronto of the International Society of Stem Cell Researchers is so pivotal. And with that conference, we decided what better time to let the public know where stem cell research is at, and that's why we are launching Stem Cell City. We are going to give people the information they need to know that will affect their lives, their children, their friends, their loved ones. The biggest message is to please join Stem Cell City.
I want to begin by thanking Rob and Cheryl for their tremendous leadership, generosity, and hard work in making Stem Cell City a reality. What really drives discovery, progress, and creates breakthroughs in science is hope. Hope fueled by hard work and imagination and perseverance. To Rob and Cheryl, to Dr. Keller, to scientists near and far who work hard, imagine, and persevere, on behalf of millions around the world who look to you, who have faith in you, and to whom you give hope, thank you. Today, we're taking a necessary step, and one day it is our hope that people with spinal cord injuries will be taking steps of their own. And cancer research will take great steps forward, and what seems impossible now will be commonplace tomorrow. Once again, I want to thank everyone who's made this step possible. Thank you for your hard work, your imagination, your perseverance. Thank you for giving so many around the world hope. Thank you very much.
Thank you, Premier, for those inspirational and aspirational words. And special thanks to you and your government for your contribution of more than $27 million to the McEwen Centre, to other stem cell researchers across Toronto and the rest of the province of Ontario, and making this one of the capitals of stem cell research literally around the world. Thank you, Premier.
It's an honor for me to direct the center and to really watch stem cell research grow and our ability to translate what happens in a petri dish to a patient. And really that's the vision, the goal of the McEwen Centre. Can we really make something interesting happen from all the exciting research we're doing? So we do a lot of different things in the center. I show what we do in our lab most often, but we work on the heart, we work on the blood system, the brain, the pancreas, and lungs. So we have a very broad program. So we have ongoing programs. We're looking at better ways to treat spinal cord injury, the chance to cure blindness, better ways to count stem cells, better understanding of heart disease. That's all being funded right now today in the McEwen Centre. But people always ask, what about the future? Where are we going? How fast can we get there? With heart cells, what would you do with heart cells? They're going to be used very shortly to test drugs on. What else can we do? We can take cells from anybody in this room and through a process called reprogramming make what we call a pluripotent stem cell, or the equivalent of an embryonic stem cell. So we could essentially make anyone's heart cells, liver cells, blood cells, or pancreas cells. This is happening today. This is not tomorrow. This is happening today, right now. And finally, can we take the components of what I showed to the Premier, these speeding cells, and can we construct a piece of human tissue? Can we construct a piece of heart tissue, a piece of liver tissue, or a functioning piece of pancreatic tissue? Transplant that back into a patient and show improvement, if not cure. That's tomorrow, and I don't think it's going to be too far off.